Hello to everyone
Bonjour
from
à tous
WHO
et à
headquarters
tous
here in
depuis le
Geneva. My name
siège de
is
l'OMS
Tariq
à
and we
Genève. Je
welcome
m'appelle
you
Tariq. Je vous souhaite la
for our
bienvenue
regular
à
press
l'occasion
briefing
de
on
notre
COVID-19.
conférence de presse régulière sur la Covid-19.
Today, as we
Aujourd'hui,
had previous days,
comme
we have simultaneous interpretation
les dernières
to
fois, nous
6 UN
proposons
languages
l'interprétation
plus
vers les 6 langues
Portuguese, and I
des
would like
Nations
to
Unies, plus le
take this
portugais.
opportunity to thank
Donc je saisis
interpreters
l'occasion
who
qui
are
m'est donnée pour
here with
remercier
us
les
and who will help
interprètes qui sont
have the
ici
information
avec
interpreted
nous
in
et qui
those
vont
languages.
interpréter vers les
We
différentes
also have
langues que je
sent
viens de citer.
a
Nous
number
avons
of
également
documents
envoyé un
from
certain
our
nombre
regional
de
offices as
documents
well
de
as
nos bureaux
invitation
régionaux ainsi que des
to press
invitations
briefings from
aux
our regional
séances de
colleagues
presse à
that you
nos
may
collègues
wish to
régionaux que
follow.
vous souhaiterez
Today
peut-être
we have
suivre.
Dr.
Aujourd'hui,
Tedros,
le
Director General,
docteur Tedros,
Dr. Maria
directeur
Van
général,
Kerkhove, and
est présent, le docteur
Mike
Maria
Ryan
Van
with us,
Kerkhove et
and I
le
will give the
docteur
floor
Ryan.
immediately
Je vais sans plus
to
attendre
Dr.
donner la
Tedros
parole au
before
docteur
we
Tedros
open
avant
the floor to questions. Dr.
que
Tedros, please.
l'on ne prenne vos questions. Je vous en prie, docteur Tedros.
Thank you, Tariq.
Merci Tariq.
Good morning,
Bonjour.
good afternoon, and good evening.
Ou bonsoir.
As of tomorrow, it will be 3
Demain,
months
cela fera
since
3
I
mois
declared the
depuis
public
que
health
j'ai
emergency
déclaré
of
une
international
urgence
concern
de santé
over
publique
the
de
outbreak
portée
of novel
internationale
coronavirus.
due à
Today,
la flambée
I would like to
de
take a few
ce
moments
nouveau
to look
coronavirus.
back at the
Aujourd'hui,
period
j'aimerais
preceding
prendre
that
quelques instants
announcement
pour
to be clear about
faire le point
what WHO
sur la
knew
période qui a précédé
and
cette
what
annonce
we did,
pour
which could help
expliquer
the country to
clairement ce que
understand
savait l'OMS et ce que nous
the
avons fait
3
pour que les pays
months.
comprennent
On the
ces
31st
3
of
mois.
December,
Le 31 décembre,
WHO's Epidemic Intelligence System
le
picked
système
up
de
a report
renseignement sur
about a
les
cluster
épidémies de
of
l'OMS
cases of
a
pneumonia
eu un
of
rapport
unknown
sur un
cause
foyer de cas
in
de
Wuhan,
pneumonie de
China.
cause inconnue à Wuhan, en
The
Chine.
following day,
Le jour
New
suivant,
Year's Day,
le
WHO
jour du
asked
Nouvel
China
An,
for more
l'OMS
information
a demandé
under
à la
the
Chine davantage
international health
d'informations
regulations
sur
and
le
activated our
RSI et
incident
a
management support team
déclenché
to
son
coordinate
équipe
the response across headquarters and our
d'appui
regional
de gestion des
and country
incidents pour
offices.
coordonner la riposte entre
On the
le
2nd of
siège et
January,
les bureaux régionaux et de
WHO
pays. Le
informed
2
the
janvier,
Global Outbreak
l'OMS
Alert and Response
a
Network, or
informé
GORN,
le GOARN,
which
le
includes
réseau de
more than
riposte et
260
d'alerte
stations
en
in
cas
more than
de flambée
70
mondiale qui
countries.
comprend plus de 250 institutions
Yesterday
dans plus de
was
70 pays.
GORN's 20th
Hier,
birthday,
c'était le 20e
and I would like to
anniversaire
use
du
this
réseau
opportunity
et
to
j'aimerais
say
saisir
happy
l'occasion qui
birthday
m'est
to
donnée pour
GORN
dire bon
and thank
anniversaire
you and
au
congratulations
réseau
to every
GORN
single
et
GORN member
félicitations à tous les membres
for
de
their
ce
commitment
réseau de
to
riposte et
responding
d'alerte
to the
pour la
COVID-19
façon
pandemic and
dont ils ont
many other
riposté à la pandémie
emergencies.
et à beaucoup d'autres
We're really
urgences.
proud to work
Nous
with
sommes
you.
très fiers de travailler
On
à
the
vos
3rd
côtés.
of
Le
January,
3 janvier,
China
la
provided
Chine a
information to
fourni des
WHO through
informations
a
à
face-to-face
l'OMS
meeting in
lors
Beijing
d'une réunion
and through
présentielle à
WHO's
Beijing
event
et
information
par le
system
biais du
established under
système
the international health
d'information sur les événements
regulations.
et qui a été
On
créé
the
dans le
4th
cadre
of
du
January,
RSI. Le
WHO
4 janvier,
reported the
l'OMS
cluster of cases
a
on Twitter.
présenté
At that
un
stage,
rapport
no
sur le
deaths were
foyer de cas
reported.
sur Twitter.
On the
À
5th of
ce stade,
January,
il n'y avait encore aucun
WHO
décès
shared detailed
enregistré. Le
technical
5 janvier,
information through
l'OMS
its
a
event
donné des
information
informations
system.
techniques détaillées par
This
le biais de son
included
système
advice to all
d'information
member
sur
states
les
and
événements.
IHR
Il y avait
contact
notamment
points
des conseils à
to
tous
take
les États membres et aux
precautions
points
to
de
reduce
contact
the
du
risk of
RSI.
acute respiratory
Il s'agissait de prendre
infections,
des précautions pour réduire le risque
providing
d'infection
guidance
respiratoire
on the
aiguë.
basis
On a
that there could be
également indiqué
human-to-human
qu'il pourrait y
transmission.
avoir une transmission
On the same day,
de humain à humain. Le
WHO
même
also
jour,
issued its first
l'OMS
public disease
a
outbreak news,
publié sa première
publishing technical
notice
information for the scientific
de
and
flambée de
public
la
health
maladie
communities,
en publiant
as well
des
as
informations
the
techniques
world's
à l'intention des
On
communautés
the
scientifiques et de
10th
santé
and
publique,
11th of
ainsi
January,
qu'à l'intention des médias du
WHO
monde entier.
published
Les
a
10 et 11
comprehensive
janvier,
package of
l'OMS
guidance
a publié
on
toute
how to
une série
detect, test
très
for,
complète
and manage cases,
d'orientation
and protect
et
health
de
workers from
directives sur
potential
la
human-to-human
manière de
transmission
détecter, de
based on our
tester
previous
et de gérer les
experience
cas
with
et de protéger
coronaviruses.
les agents de santé d'une
We also
transmission d'homme
published
à homme, à
a
la
readiness
lumière de notre
checklist to
expérience
help countries
précédente avec
assess
les
their
coronavirus.
capacities and gaps
Nous avons
for detection
également
and
demandé aux
response.
pays de faire une analyse des lacunes
Because
dans leur
Wuhan
riposte.
is a
Étant
major
donné que
domestic and
Wuhan
international transport
est
hub,
pôle
WHO also
de
advised
transport
that the risk of
majeur
cases being
international
reported from
et
outside
national,
Wuhan.
que
On the 11th of shared the genetic sequence of the virus for countries to use in developing testing
était
kits.
augmenté. Le 11
On
janvier,
the
la
same day,
Chine a signalé
China
le premier
reported the
décès
first
du...
death. Because Wuhan is a major domestic and international transport hub, WHO also advised that the risk of cases being reported from outside Wuhan was increased. On the 11th of January, China shared the genetic sequence of the virus for countries to use in developing testing kits. On the same day, China reported the first death from the new coronavirus. On the 13th of January, the first case was reported outside China in Thailand. That day, working with partners, WHO published the first instructions for how to make PCR-based diagnostic test kits, enabling the world to find cases. And I would like to use this opportunity to thank Germany. On the 14th of January, WHO tweeted reports from China that preliminary investigations by Chinese authorities had found no clear evidence that human-to-human transmission was occurring. This is in line with our practice of reporting to the world information that countries report to us. We post countries' reports as is. However, earlier the same day, WHO held a press briefing at which we said that based on our past experience with coronaviruses, human-to-human transmission was likely. And our senior experts participated in that press conference. And that news was carried by mainstream media. On the 20th and 21st of January, WHO staff visited Wuhan. And on the 22nd, reported that the evidence suggested human-to-human transmission was occurring. On the 22nd and 23rd of January, I convened the emergency committee consisting of 15 independent experts from around the world. At the time, 581 cases had been reported and only 10 cases outside China. The emergency committee was divided in its opinion and did not advise that I declare a public health emergency of international concern. The committee asked to reconvene in 10 days or less to allow time for more information and evidence to be collected and considered. On the 27th of January, I traveled to Beijing with WHO's Chief of Emergencies, Dr. Mike Ryan, and other senior WHO staff, and met with President Xi Jinping and other leaders to learn more about the response and offer WHO's assistance. We discussed the seriousness of the situation and agreed that an international team of scientists should travel to China to look into the outbreak and the response, including experts from China, Germany, Japan, the Republic of Korea, Nigeria, the Russian Federation, Singapore, and the United States of America. On the 30th of January, I reconvened the emergency committee, and after receiving their advice, because of the new information they gathered, they had a consensus, I declared a global public health emergency, WHO's highest level of alarm. At the time, as you may remember, there were less than 100 cases and no deaths outside China. To be specific, we had 82 cases outside China and no death when we declared the highest level of global emergency. From the beginning, WHO has acted quickly and decisively to respond and to warn the world. We sounded the alarm early, and we sounded it often. We said repeatedly that the world had a window of opportunity to prepare and to prevent widespread community transmission. We started our early press conference. People were saying, the world would be tired of you if you're making a press conference every day. But we didn't mind. We wanted to make sure that the world understands what we are saying. WHO is committed to transparency and accountability. In accordance with the international health regulations, I will reconvene the emergency committee tomorrow, because it's almost 3 months since we declared the highest emergency, and that was what was suggested by the emergency committee, to reconvene 3 months after the declaration, to evaluate the evolution of the pandemic and advise on updated recommendations. In the 3 months since the emergency committee last met, WHO has worked day in, day out to sound the alarm, support countries, and save lives. We have worked with countries to help them prepare and respond. We have brought countries together to share experiences and lessons learned. We have brought together thousands of experts to analyze the evolving evidence and distill it into guidance. We have convened researchers to identify priorities from all over the world. We have launched a large international trial to find answers fast about which drugs are the most effective. We have brought together a consortium of countries and partners to accelerate the development and equitable distribution of vaccines, diagnostics, and therapeutics. We have shipped millions of test kits and tons of protective gear all around the world, focusing on those countries who need our support most. We have trained more than 2 million health workers, to be exact, 2.3 million health workers around the world. We don't think that's enough. We will continue to train more. We have worked with tech companies to fight the infodemic. We have kept the world informed in multiple ways, including these regular press conferences answering your questions. We have brought together entertainers to provide music and laughter, even in these dark times. Using this opportunity to thank Hugh Evans, my friend from Global Citizen, and Lady Gaga for bringing the whole world together. And we have watched with admiration as the world has come together in solidarity to fight this common enemy. We share the grief and pain of so many people around the world, and we share the hope that we will overcome this pandemic together. There is one thing we haven't done. We haven't given up, and we will not give up. We won't. Our commitment remains to serving all the people of the world with science, solidarity, and solutions, but above all, with humility and respect to all people and nations. WHO is now working to provide the critical strategies, solutions, and supplies that countries will need in the coming weeks and months. One thing that we would ask is unity at the national level and solidarity at the global level. More than ever, the human race, humanity, should stand together to defeat this virus. I have said it before. This virus can wreak havoc. It's more than any terrorist attack. Said it before. It can bring political, economic, and social upheavals. But the choice is ours. And the choice should be unity at national level. The choice should be global solidarity, standing in unison. The choice should be humanity against this virus. I thank you.
Thank you very much, Dr. Tedros, for these opening remarks. Before we open the floor for questions, just to remind everyone that we have simultaneous interpretation into 6 UN languages, and that's Russian, English, French, Spanish, Chinese, Arabic, and we also have Portuguese. For journalists who are watching us on Zoom, you have to click on interpretation, and then there is just one little thing that Arabic is under Korean. So I don't know really why is that, but if you want to listen in Arabic, you have to click on Korean. So if that's okay, we will ask everyone to be very short and have one question, so we try to take as many as possible. So if we may start, also just to remind you that we cannot unmute you, so if we call on you, please unmute yourself and you will be able to ask questions. So we will start with Kazakhstan, with Janat Ahmetova from TV channel Habar. Janat, can you hear us?
Yes, good evening. My name is Janat Ernest. I'm a correspondent of agency Habar. My question is, in the framework of regional cooperation, Kazakhstan has provided humanitarian assistance in the fight against the coronavirus pandemic to Kyrgyzstan and Tajikistan. Several countries provided such assistance to Kazakhstan. How is such a partnership built in other regions of the world, and how does this correlate with WHO's work in this direction? Thank you.
Thank you for the question, and again, I thank you to Kazakhstan for the help you're providing in the region and the assistance you're getting from others. I think we've seen in this pandemic that very often, it doesn't matter what level you're at, the most effective and welcome assistance comes from your neighbours. And that may be the house next door, but sometimes it's the country next door. Neighbouring countries share very often common peoples, common languages, common cultures, a common approach to the world, and usually have very deep rooted connections between countries. And those trusting relationships in situations like this can be relied upon to allow for assistance, support and solidarity to move between countries. I also believe it's a pathway through this pandemic as countries who are close to each other, have those historic links, can begin to open and trade and work with each other in a careful and stepwise manner. So having good neighbours is always a very positive thing. Also, I believe across the whole sub-region, from Turkey all the way through to Kazakhstan, Tajikistan, the Turkic-speaking nations have worked together very effectively in providing mutual support. Sub-regional and regional collaboration and coordination is very important. The Director General, Dr. Tedros, has worked with our regional directors and so many of the regional collections of ministers and governments, with ASEAN, with the African Union, with the CARICOM, with so many other regional integration organizations which provide a basis for cooperation and support between countries. So yes, I do think that local support in sub-regions, regional coordination, both in terms of aligning response strategies, aligning exit strategies from lockdown, aligning innovation strategies, and working our way through this pandemic to reach a point where we have enough control to be able to resume our social and economic lives.
Thank you very much, Dr. Ryan, for this answer. For Habar TV news channel from Kazakhstan. Next question comes from Globo Brazil. That's Bianca Rotier. Bianca, can you hear us, please?
Yes, Tarek, can you hear me?
Yes, please go ahead.
Thanks a lot. My question is about Brazil, and so I will ask in Portuguese. Ao ser questionado sobre o número de mortes no Brasil, que já passou o número da China, o presidente Jair Bolsonaro respondeu, e daí? So what? Em inglês. Ele disse que não pode fazer milagres. Milagres a gente sabe que não, mas eu gostaria de saber do Dr. Tedros se, além do que já tem sido feito, há mais que o Brasil deveria fazer no combate à Covid-19, o que ainda falta, o que ainda precisa ser feito?
Bianca, can you please repeat the question? Because Dr. Tedros was not able to hear everything. Can you just repeat slowly, please?
Do you prefer in English?
Dr. Tedros, it's number 2 channel. Okay, please just repeat in Portuguese. It's okay, thank you.
Ok. Quando foi questionado sobre o número de mortes no Brasil, que já é um número superior ao número da China, o presidente Jair Bolsonaro respondeu, e daí? Ele disse que não pode fazer milagres. Eu gostaria de saber do Dr. Tedros o que o Brasil ainda precisa fazer no combate à Covid-19, além do que já tem feito.
Thank you very much.
Thank you. You know, there was a question asked from Brazil, when was it? Last Monday. And I was informed that the newspapers in Brazil actually carried something I never said. Maybe out of, what do you call it? Out of perspective. The response I had was a response how all countries should actually do. And to be honest, even now, from the information you're giving me, I would not comment on what the president said without checking what he really said. So that's what I would like to say. And we're talking to Brazil on a regular basis. So if they have questions or if they have issues, they can talk to us. And if there is any comment that's made, we would like to hear it directly. Thank you.
Thank you very much, Dr. Tedros. Now we will go to Simon Ateba from TV News Channel Africa. Simon, can you hear us?
Yes, I can hear you. Can you hear me?
Yes, please go ahead.
Thank you for taking my question. My name is Simon Ateba from Today News Africa in Washington, D.C. My question is on testing in Africa. Dr. Tedros, as you know, in most part of Africa, testing remain extremely inadequate in most part of Africa. For instance, Nigeria has almost 200 million people, but only 11,000 tests have been done so far. And the trend seems to be the same in other countries in Africa. I was wondering if you could expand again on all the ongoing effort the WHO is doing to expand testing in Africa. And if I may add quickly to Dr. Marie, if you could clarify in detail what type of personal, private health information you are giving tech company, and how long can they store that private personal information? Thank you.
The DG may want to respond on the broader capacities in Africa, but in terms of laboratory testing capacity, I think led by the Institut Pasteur in Senegal, the National Institute for Communicable Diseases in South Africa, and working with ourselves on the African Union and the Africa CDC, the capacity for both the laboratory technicians to do the testing and the distribution of tests has occurred across Africa. I do agree with you, Simon, that the availability of tests is still a critical issue, as it is in many parts of the world. And I can assure you that we have recently effected deliveries of personal protective equipment and more testing and test kits to 51 countries on the African continent. Those flights were just completed this week. But over the coming few weeks, there will be a huge scale-up in terms of automated tests, manual tests, swabs and media and all of the other material needed for testing right across low middle income countries and within about 140 priority countries. And in fact, I think all countries in sub-Saharan Africa are included as part of that priority list. And we will be procuring and shipping over 5 million manual test kits for those countries. So there will be, and this is under the supply chain task force that the Director General kicked off in the last number of weeks with the UN Secretary General. And we've been working on supply chain management now for months, but bringing together the architecture of identifying supplies in a global supply chain that's essentially broken, validating those test kits that were available, scaling up the production of those test kits at the manufacturers, procuring those kits and arranging for them to be transported to countries, along with PPE, along with the other supplies, along with the swabs and the media, has been a challenge. And we'd like to thank our partners out there, those who've worked with us on procurement, like UNICEF, like the Global Fund, like UNITAID, many, many others, the Gates Foundation, and those partners who are working with us on allocation and distribution, like the World Food Programme. And I forgot to mention our colleagues at the Clinton Health Access Initiative as well. So we've seen a coming together of a global consortium of institutions and organizations who are fundamentally focused on ensuring that we fill the gaps in the supply chain, especially in low and middle income countries and especially in countries affected by fragility and conflict. We intend to fill a significant proportion of that gap in the coming weeks and months and be a reliable source of PPE, of testing capacity and equipment and supplies, as well as other medical supplies and ventilators to countries and populations all over the world. We are doing and striving our best to identify the funding and the transport mechanisms and the way to guarantee those supplies. But might I say, in the context of a very, very broken global supply chain, where production, procurement, distribution is extremely difficult. And again, would like to thank our partners for that. With regard to, we have a lot of collaboration with the private sector and with the IT sector on our work both to protect our systems here in Geneva and around the world, but also on developing solutions for the field and developing solutions for public health. I can reassure you that there is no personal data being held by private sector companies on any of the elements to do with COVID-19 or anything else for that matter. So just to reassure you that we are not passing personal data to private companies of any kind, and especially to IT companies on this issue. And all of our data sharing is within our data protection and ethical considerations that pertain. So just to reassure you on that.
Yeah. So on the our partnership with tech companies, the partnership we started is mainly to fight infodemics. So if it's because of the recent discussions and agreements we had with them, it's about fighting infodemics and it's not about sharing data. But as Mike said, we take private information very seriously. But the agreement we had recently is not about that. It's about fighting infodemics together and routing all those who have questions about coronavirus to the right site or to the right agency, meaning to WHO and other reliable agencies. And they're doing that. Facebook is doing that. Google is doing that. And other tech industries are doing that and directing any questions to the right institutions. But at the same time, when there is misinformation or fake news, they remove it immediately. So that's where we're focused now in our partnership with them.
Thank you very much for this. Now we will go to NHK, Japanese news agency. Shoko, can you hear us, please?
Can you hear me?
Yes, please go ahead.
Okay, thank you for taking my question. So some countries are reporting a possible link between COVID-19 and Kawasaki disease. What's the position of WHO on this issue? Thank you.
Maria, may I supplement? Oh, you want to go? Yeah, please. Sorry, I thought you were just...
No. So yes, I'll start and maybe Mike would like to supplement. So yes, we are aware of this report, which came out of the United Kingdom, about a small number of cases amongst children with its inflammatory response. We're looking at this with our clinical network, and in fact, our clinical network had a teleconference yesterday which discussed this. And if I can remind you, we have a global network of clinicians that are dealing directly with COVID-19 patients across the globe, and they meet at least once a week, if not more, to exchange information. And what they're doing is trying to better understand how this infection affects the body and the disease that it causes. So we do know so far with regards to children that continuing in our understanding of this, that data from this disease in children, they tend to have less severe disease, so they tend to have overwhelmingly mild disease, but there are some children who have developed severe disease and some children who have died. There are some recent rare descriptions of children in some European countries that have had this inflammatory syndrome, which is similar to the Kawasaki syndrome, but it seems to be very rare. What we've asked for is for the global network of clinicians to be on alert for this and to ensure that they capture information on children systematically so that we could better understand what is occurring in children and so that we could better improve our understanding and guide treatment. But it seems to be very rare. And only in maybe 1 or 2 countries so far, and in a number of countries, and additional countries, they have not reported this yet, but this is something that the clinical network is looking into specifically.
And I just may supplement and emphasize for all parents out there that the vast majority of children who get COVID-19 will have a mild infection and recover completely. And Kawasaki syndrome is a syndrome that's been around for a long time. It's a rare condition. It happens. It usually resolves itself, and it is associated with inflammatory processes in the blood vessels, and something that we're very grateful to the clinicians who've observed this in children. But they have said this is an atypical Kawasaki syndrome. They're describing something they have seen in children. It's a very important observation. And it may reflect too, as we've seen in adults, the fact that the SARS-CoV-2 virus causing COVID-19, obviously is causing inflammation and attacks tissue other than lung tissue. And we may be we are in a situation where clinicians are looking at what those other effects of having this coronavirus infection are. And we've seen this in the past with many emerging diseases. They don't necessarily only attack one type of tissue. There can be multiple organs affected, and many of you have seen the reports of other organs that have been affected with this disease. So it's really important that this information is shared around the world. It's really important that pediatricians and clinicians get time to collect information and share that. But again, just to reassure parents out there, this is a rare complication, and one should always be watchful in children who are experiencing infectious disease for any deterioration in their condition. But I think it's important that our parents out there are reassured.
Thank you for this. Now we will go to Reuters and Stephanie. Stephanie, can you hear us? One more time, Stephanie from Reuters. Can you hear us? You need to unmute yourself.
Yep. Thank you. Sorry. Yes, I wondered if perhaps Mike could comment on some of these reports on remdesivir that have come out. There's some indications in the Lancet that it's not been that effective. The company is saying that it's helped improve outcomes for patients, and given some data that they say is encouraging. I wondered if you could help us on that. It's still all coming out, of course.
Yeah, thanks, Stephanie. No, I wouldn't like to make any specific comment on that because I haven't read those publications in detail. It's always very important that we consider all publications related to, and it can sometimes take a number of publications to determine what the ultimate impact of a drug is. And clearly we have the randomized controlled trials that are underway both in the UK and the US, and on the Solidarity trial with WHO. And remdesivir, I think, is one of the drugs under observation in many of those trials. So I think that a lot more data will come out. We're all hoping, and fervently hoping, that one or more of the treatments currently under observation and under trial will result in altering clinical outcomes or improving clinical outcomes, and in ensuring that less people die or that less people have a severe course of illness. But I wouldn't like to make any comment. Maria, you may have read the papers, or we like to look at papers not just as one paper. We like to look at a group of publications and then be able to compare and use our clinical networks in order to do a proper review. We have a scientific review process in-house where we do systematic reviews at various times on different aspects of the response, especially on drug efficacy and the efficacy of other interventions. And we would like to look at that in the context of a broader look at the overall data regarding remdesivir. But we are hopeful that this drug and others may prove to be helpful in treating COVID-19. Maria?
Yeah, thanks, Mike. So it's a great question, and it's a good opportunity to explain a little bit about how we actually evaluate the evidence. So there are studies that are coming out, particularly on therapeutics, but in all aspects of this novel coronavirus and this new coronavirus causing this pandemic. And it's something within the scientific community. What we try to do when we evaluate the evidence is we look at what we call the weight of the evidence, where we pull together all available evidence, all available studies on any particular topic, whether these studies are conducted in a laboratory, through experimental conditions, whether they're done in observational studies or epidemiologic studies in people, whether these are done through clinical trials. And what we do is we pull together every shred of evidence, every piece of evidence we can get our hands on, and we review it and we critique it. And in this particular pandemic, we have a large volume of papers that are being shared with us prior to publication. These are the pre-publication materials. And this is amazing. This is such a positive aspect of this pandemic, and we thank all researchers who are willing to do that with us. But it is an important process for papers to go through what we call the peer-reviewed process, which means they submit a paper to a journal, and then they have top experts in that field really go through in detail and review that article. And then it goes back to the authors, and they modify it, and then they resubmit. So oftentimes, when you submit a paper, by the time it goes through the peer-reviewed process, it actually looks a lot different when it actually gets published in a journal. And for us, we're trying to digest all of the information that comes to us that are pre-publication, and also the ones that are coming out in peer-reviewed journals. Once we do that, we look at all of the studies, and we judge them in the sense of this is a better study, this is more robust, and this study has some significant limitations. Once we are able to take that collectively, we can come away with some kind of a conclusion of, yes, we see an effect, no, we don't. Yes, we know more about this disease in children, or something about transmission, or whatever the topic may be. And then we go one step beyond that. Then we debate these results with our global expert networks. And this is a healthy debate. It's a constructive debate where we actually look again and we say, what does this tell us? And what does this mean in terms of our guidance to our member states, to all people all over the world? And that's a really important process to go through. That can be sped up, especially in emergencies when we need to do this very quickly, but it doesn't change our willingness and our desire to do this very comprehensively. Right now, what we are doing at WHO is we're working with our science division, and we're working with partners at Gorn who are conducting living reviews for us. So every day we are looking at the publications that come out in the peer-reviewed journals and the publications that are being sent to us before they reach the journals. And we're conducting living reviews on about 30 topics right now, so that we can stay in tune with what is coming out. So typically you don't have one study that will come out that will be a game changer. There could be, if it's a very well-designed study, if there's enough cases and controls, it could really change our understanding. And if that happens, we will adjust our guidance. But there is a process for this to take place, and we're really grateful for all of the scientists and experts that work with us to help us develop this guidance and understand all of this research that's coming out.
Thank you very much, Dr. Van Kerkhove. Next question is for Gunilla van Hol from Swedish media. Gunilla, can you hear us?
Yes, can you hear me?
Yes, please go ahead.
Thank you. My question is on Sweden. It's a country that chosen a different road and strategy, basically no lockdown and an open society through the crisis. Could this mean that the population of Sweden, maybe other countries that have not had strict lockdowns, have a chance to be better protected in case of a second wave, as they have been more exposed and have had a chance to develop a possible herd immunity? Thank you.
Thank you. I think two things here. I think there's a perception out there that Sweden has not put in place control measures and has just allowed the disease to spread. Nothing could be further from the truth. Sweden has put in place a very strong public health policy around physical distancing, around caring and protecting for people in long-term facilities and many other things. What it has done differently is it has very much relied on its relationship with its citizenry and the ability and willingness of citizens to implement physical distancing and to self-regulate, if you want to use that word. And in that sense, they've implemented public policy through that partnership with the population. They've been doing the testing, they've ramped up their capacity to do intensive care quite significantly, and their health system has always remained within its capacity to respond to the number of cases that they've been experiencing. Like many other countries in Europe, Sweden has experienced some many clusters of disease and long-term care facilities, but that's unfortunately and tragically not a unique event in Europe. Many countries across Europe have experienced the same tragedies over the last number of months, and that's something that really needs to be looked at very carefully all over Europe. Even as the numbers go down, our elderly, our older citizens are still dying in large numbers in many nursing homes and long-term care facilities, and more needs to be done to protect and stop the cluster, those clusters and prevent disease spread in those settings. With regard to this concept of herd immunity, I think we'll wait. I believe seroprevalence studies are underway in Sweden as well as many other countries, and Maria can speak to that because WHO, with our partners, have done a large review of all of the seroepidemiologic studies that are underway and some of the results that are available. But I would say that the general outcome, even in areas of fairly intense transmission, the proportion of people who have seroconverted or who have antibodies in their blood is actually quite low, which is a concern because it does mean the vast majority of people remain susceptible. So the chances of disease rebounding or returning is quite high, especially if control measures if control measures or lockdown type measures are released too quickly without being replaced by case finding, contact tracing, testing and strong community compliance. I think if we are to reach a new normal, I think in many ways Sweden represents a future model of, if we wish to get back to a society in which we don't have lockdowns, then society may need to adapt for a medium or potentially a longer period of time in which our physical and social relationships with each other will have to be modulated by the presence of the virus. We will have to be aware the virus is present, and we will have to, as individuals and families and communities, do everything possible on a day-to-day basis to reduce the transmission of that virus. And that may mean adjusting the way we live our lives. and I think maybe in Sweden they're looking at how that is done in real time. So I think there may be lessons to be learned from our colleagues in Sweden.